Hello, everyone, and welcome back to Beyond Surviving to Thriving. Look better, feel better, be better by kicking MS and other autoimmunity in the butt. I'm your host, Yvette Brisco, and I'm so excited to welcome our guest for today. I actually found him on Twitter, and I was following his posts and really enjoying the information that he was providing. And so I reached out and asked him if he would be here today to talk to us a little bit about some of the things that that he sort of shares with his followers, but to dive a little bit deeper for us to be able to get down to some of the things that we really find important and that we can use a little assist with. So today I'd like to welcome Dr. Brandon Beaver. Thank you so much for agreeing to come on today.
Thank you for having me, Yvette. It's a pleasure.
All right. So tell us a little bit about you. Tell us a little bit about your background and why you chose to specialize in MS.
So I'm a neurologist and mostly a clinical neurologist seeing patients. I work for Kaiser Permanente, and right now I'm working in Downey, which is South Los Angeles. And, you know, I'm interested in a lot of different things. I've done some epidemiologic research, but mostly I just want to see patients and take care of patients. And the beautiful thing about MS is that you really have the opportunity to spend a long time with patients and get to know them over the years. I mean, I have patients that I've been seeing since I first came to Los Angeles in 2009, and it's an amazing thing. You see people evolve and grow and deal with challenges. And, you know, some doctors are a little bit different. They like to see stroke and trauma and, you know, see all the action, but I'm not like that. I like to get to know people and form relationships with people. And it's an incredibly interesting field. Even since I've been in the field, there's so many new developments. I mean, what we did 5 years ago was totally different from what we're doing now. And if you think about the future of MS, I think that a lot of the things that we're going to talk about today are really going to start to matter and going to be used for patients, not just to be theoretical anymore.
Absolutely. And, you know, one of the things that I like about when we do this is being able to connect with people in so many different areas and learning so many different things about where we are, where we've been, and where we're going. So I think that, you know, connecting with somebody who really feels a passion for helping people with MS is always a bonus as far as I'm concerned. So yes. All right, we're going to jump into our topic today. And today we are talking about cognition. So for me personally, when I was first diagnosed and started seeing the cognitive changes and the decline there, I had a more difficult time dealing with that than I did the physical symptoms. You know, if I tripped and fell because my balance was off or whatever, I could laugh about that. But if I stopped mid-sentence because I was doing word searching, that wasn't so funny to me, you know? And so as I've progressed, I've been able to handle it a little bit better and to do other things that sort of help me to adjust better. But I guess, you know, it's always good to learn about what is happening in research and what are things that we can do to give us the longevity that we need to be able to live a full life with this disease. So let's jump right in and talk about some neuroplasticity.
So, you know, I think what you're talking about is a very common complaint. I mean, you know, when people who are laypersons think about MS, they're thinking about, oh, am I going to be in a wheelchair? I'm going to have physical disability. But when people actually do surveys, you know, people who actually have MS often rate things like fatigue, you know, cognitive complaints, which may be relatively mild. People may still be very intelligent, still be working, and things like pain as their most severe symptoms. And, you know, the question is, what can we do about it, both in terms of lifestyle changes and what can we do about it as scientists to actually develop new interventions? There's no current FDA-approved treatment that directly influences neuroplasticity, but there probably will be, maybe even within 3 to 5 years. So, you know, just to talk in generalities, one thing that's very interesting about MS is that there's not a very high correlation between what we see on the MRI and the patient we see in front of us. And this has been known for many years. So I won't be too technical, but if you look at an MRI scan, the lesions that are related to MS are often bright on the T2 sequences. Right. But there's not a very high correlation between the number of lesions and the severity of the symptoms. You know, I saw a patient and I looked at her MRI before she came in for the appointment and it was completely whited out. The whole thing looked abnormal. But when I saw her, she was working full time. She had 5 kids, and she was older and had MS for a long time. And the reason is because a lot of that tissue may be abnormal, but it's not dead. And the things that correlate more strongly with actual disability are things like brain volume or spinal cord volume. You know, if your spinal cord is shrunken, probably you're going to have a lot of symptoms related to that. If your brain is shrunken and you've lost brain volume, probably you're going to have some cognitive impairment and other symptoms. And what's fascinating is that people have done pathological studies where they actually do autopsies and look at the brain under the microscope and sort of correlate it with the patient and correlate it with what we see on MRI. And often there's a lot of remyelination. So to take a step back, you know, MS is kind of unique in that it's very common for our patients to get better. You know, the number of patients I've seen who were in a wheelchair but recovered to the point where they could walk normally, you know, well over 100. I mean, it's a very common thing. And part of the reason is because, you know, you could have some inflammation and swelling that goes down, but part of the reason is remyelination. In MS, the immune system tends to go after the myelin, the fatty sheath of the nerve fibers. But the nerve fibers, the axons themselves, are often spared. And so if you can remyelinate, you can get a lot of function back. And so sometimes, even if the spot looks white on the MRI, if we could look at the tissue, we could see that there's actually remyelination. The myelin may be abnormal, it may be a little bit thinner. The nodes of Ranvier, which are sort of the normal junctions between myelin, may be a little bit closer together, but it still may be functioning. And that's one of the reasons we think people with MS may have a lot of fluctuation in symptoms, because you had this injury, you kind of recovered from it, but maybe when your body is under physiologic stress, illness, infection, fever, you know, even emotional stress, sleep deprivation, you may suddenly be much worse off. And a lot of people don't understand that, so they think people with MS are faking or exaggerating their symptoms. Like you walk normally, but then you walk a couple blocks and you're dragging your legs. Well, maybe because your body temperature heated up a little bit and suddenly your spinal cord isn't functioning as well.
You know, I think that that's one of the hard things that when you're talking to a layperson to explain to them, and I know when I'm in my online support groups, one of the biggest complaints that people have is when people come up to them and say, "You have MS, but you look so good," right? And it's right. That, you know, we call it the invisible disease. Our symptoms are invisible. People can't see it on the outside unless you are physically in a wheelchair or whatever. But yes, I think that you are like 100% on to what tends to bother us, because a lot of times too, if I'm having a bad day, then I'll stay home. So I'm not out and about where people see me where I'm doing that. And I was talking to another doctor, and he was saying about social media, and maybe I should start taking a few pictures of bad days and sharing those so people get a more realistic picture of what it's like to have MS. But talking about remyelination, so what the research that I've done, and it's been a little bit since I, you know, dug a little bit deeper on that, but it said that one of the problems is that our body has a slower pace of remyelinization than the rate at which the MS is actually destroying the myelin. So we can't keep up with it, which is why I guess where it's coming back, the location of where it's coming back shifts in different places. So we might feel better and be able to walk again, but then we feel worse because our fatigue has increased, or, you know, the vision has gone blurry again, or whatever. So how do we, is there something that's a little bit more recent that shows that there's a way to increase the rate? Because we naturally do, right? Our bodies naturally do that repair, just not fast enough.
Well, there are 2 ways I could answer that question. You know, one is in terms of lifestyle, and one is in terms of, you know, potential future medical treatments for remyelination. Mm-hmm. So one thing that's maybe particularly frustrating if you have MS is that when we look at the tissue of MS, often we actually see the cells that are precursors to the myelinating cells in the damaged tissue. And so the cells in the central nervous system that form myelin are called oligodendrocytes. It's actually different from the peripheral nervous system, and it turns out the peripheral nervous system is more capable of regeneration, generally speaking. But obviously, the central nervous system can regenerate. And there are these cells known as OPCs, oligodendrocyte precursor cells. And there's this legendary neuropathologist, his name is Dr. Bruce Trapp, and he does these studies where, if you have MS, you can sign up to donate your body to science. And if you die, hopefully of something else, someone is on call and they'll respond immediately and try to preserve your brain fresh and look at it. And what he found is a shocking finding, that even people who are older and had MS for a long time and advanced disability, they often have the oligodendrocyte precursor cells within the lesions, but they just don't form myelin, or as you said, not fast enough.
Right.
So one reason for that is that we have natural myelin growth inhibition. And there's this protein that inhibits the differentiation of oligodendrocyte precursor cells into oligodendrocytes. And it's called LINGO-1, LINGO-1. And, this is probably important for our development because you can't form excess myelin. It has to stop at some point, and it has to only occur, in the setting of growth and development or injury. And there's actually a drug called anti-LINGO that blocks that protein, and it's being studied right now in MS. And I don't know what the result is going to be. We'll see. There's another ingenious experiment which was done, where this guy named Dr. Jonah Chan, he's at University of California, San Francisco. He thought, I want to develop a drug that remyelinates, but it's going to be really hard. So why don't I check a bunch of existing drugs and see if by luck one of them has some kind of effect on remyelination. And so he took a bunch of cells from rat optic nerves and he put them into a bunch of wells and exposed them to all FDA-approved drugs, basically. This whole kind of screen of FDA-approved drugs, FDA-approved for different things. Right. And he developed a screen for myelin generation. He developed this clever screen for myelin basic protein. And he found a small number of those drugs, just by coincidence, actually cause remyelination. Not necessarily in humans with MS, but certainly in rat tissue. And the one that had the strongest effect was this drug called clemastine, which the trade name is Tavist. And it's this old antihistamine drug. No one uses it because it's very sedating and we have better drugs. But it's interesting, it coincidentally has this effect on remyelination. And it turns out it has nothing to do with the antihistamine effect. It has to do with the effect on another receptor called muscarinic receptors.
He's doing human clinical trials now, right? Because I think that was one that I was screened for, but my optic neuritis wasn't bad enough yet. So
you're too healthy. I'm sorry.
Yes. Well, so these. There has to be other people who are doing that too. And I remember that because I kept thinking Tavist D, which was the decongestant form of it that you can get over the counter. And so I like the idea of something like that being available to sort of boost our body's own ability to regenerate that way. But we're a long ways away from that actually being something that's on the open market. Are there other things that are like that are being studied right now that I know still we're a ways away, and so we have to do lifestyle changes to help us right now, but it's nice to be able to look forward to something knowing that they're sort of on the right track with it?
Well, clemastine is available. I've had patients who have taken it. I don't necessarily recommend that because it has side effects and is not really proven. Mm-hmm. But there are a few other similar drugs that have a similar effect on the muscarinic receptors. And one is this drug benztropine, which is used for certain types of symptoms in Parkinson's disease. Okay. And another is this drug called sulfenacin. The trade name is Vesicare, and it's actually used sometimes in MS patients to treat frequent urination. So some people with MS are taking that anyways, which is interesting. Okay. Wow. So there are things that people are doing. Now, they may have a relatively modest effect. It may not be, a life-changing effect. But even if the effect is small, if you could modify these drugs to take out the side effects, it may be worthwhile.
Right. Well, I think even modest improvement when when you're faced with something that, you know, is a lifetime thing,
Right.
modest improvements are nice too. So, so I'm looking forward to sort of diving a little bit deeper into the research and seeing what's on the horizon for that. So that's awesome. So let's talk a little bit about just sort of we're having cognitive issues, right? There aren't any drugs per se that we're going to take that's going to help with that. Although I remember at the beginning, I can't even think of it right now. I'm having a cognitive moment. But I was prescribed something that seemed to help some, as long as everything else was the way it was supposed to be. And if I wasn't eating right, or if I was overextending myself physically or different things like that, then the medication didn't really have an impact, because I think it was, you know, having to fight too hard. But when we are faced with this decline and you're not looking at an opportunity just in the basic course of the disease for it to get better, you have to be proactive to do something. What do we do? Because, you know, if you're one of those people who, you know, your experiences with cog fog are devastating to you, or, you know, super emotional for you, then the stress of experiencing that symptom can often cause other symptoms and cause you to, you know, to feel bad. So what do we do?
Well, the things that have the best evidence in terms of lifestyle are probably the things that have the best evidence in terms of helping you to generate new neurons. You know, we previously thought that the central nervous system is kind of a fixed structure, a bag of wires, and it is what it is. But it turns out that you actually do regenerate some neurons in a process known as neurogenesis. And it's very slow, but over the course of decades, you know, people have calculated that by replaced your whole brain. You know, so that's very slow, but over a long period of time, it makes a difference. So the number one thing in research studies is exercise. Exercise increases brain-derived neurotrophic factor, vascular endothelial growth factor, and other factors that stimulate nerve growth and repair. And it's well known that, you know, this has an effect of human disease. For instance, marathon runners have a lower risk of dementia. You know, and obviously this is a long-term thing over many years, but it definitely has a you know, noticeable effect. And then there's certain things in terms of diet. So one thing is that saturated fat reduce neurogenesis. You know, so maybe better to eat more fruits and vegetables, more of a plant-based diet. There's some studies showing that intermittent fasting or calorie restriction may increase neurogenesis. And then there's some specific foods like isoflavonoids, blueberries, curcumin, and then the popular supplement reservatrol, which may increase neurogenesis. One thing that's been shown is that REM sleep, the type of sleep that the deep sleep of dreaming, increases neurogenesis. And one of my colleagues commented to me that if you talk to patients who are older, you know, like over 70, had MS for 50 years, and they're doing really well, a lot of those patients will tell you they sleep very well. I haven't particularly noticed that, but, you know, I don't necessarily ask every single patient about their sleep unless they're complaining to me about fatigue. You know, so it's an interesting thing. In animal studies, they've shown that you know, having sex increases neurogenesis, and drinking alcohol may reduce it. You know, so there are all kinds of little things that you can do, but probably practically speaking, try to eat a healthy diet, diverse fruits and vegetables. I don't know if doing calorie restriction or intermittent fasting is that practical on a long-term basis, and try and get adequate sleep. And some other things are using your brain, being intellectually active. You know, it's well known that if you have more education, if you work longer, if you read more, you have a lower risk of dementia. Now, that's not directly related to MS, but it probably does apply. And one thing I should mention is that, you know, you should try to treat the underlying disease. You know, if you're not treating MS and you're acquiring a lot of new lesions, then that could contribute to cognitive decline in the long run also.
So, so one of the things that I make jokes about this is that I get to play games because, you know, as part of my therapy, because, you know, I'm trying to develop those new neural pathways to go around the stuff that's messed up. And so, you know, I'll pop a game onto my phone or on the computer that is a puzzle, or that is something that makes me, you know, really try and figure out what's happening. And those, I think we call them brain games or whatever, but I think that those actually do have an impact. Although some people have an opposite opinion that it's really just because you get relaxed when you're playing or whatever, and it's not that it's actually helping to form new neural pathways. What is your opinion on that?
Well, I think anything you do to stimulate your brain, I mean, I know there's websites like fitbrains.com, Luminosity. I mean, I do, kind of recommend them to my patients. Do I think those are necessarily better than, say, playing chess, playing Scrabble, reading books? Probably not, but whatever motivates you to stay active, And
So,
being socially active is important too.
okay. So if you, one of the things somebody was saying is that if it's the complex things that you do, with your brain that seems to have the most effect. So like learning a foreign language, right? Because that's new information that you're taking on, and they're a little bit more complex than just reading a book that is not challenging you in any way. Is that do you find that that's true, or is that just we want it to be true, so we kind of say that? I mean, it's nice to know an extra language or two, right?
Well, it's probably true. Probably doing something that you're very experienced in and used to doing is not going to stimulate and challenge your brain as much. And that's the idea of these brain games. Each one is totally different from the last, and you have to adapt and learn new skills, and you're training different domains, language, spatial recognition, things like that. And so it's just the diversity of it. Yeah, I wouldn't do the same thing over and over again, try to do different things.
Okay. And then, so when we're thinking about how our brains are working, and not just like the cognitive part of it, but what's going on physically with us, do you find that that there is a relationship between cognitive changes, cognitive decline, and the other physical symptoms that people can feel?
I think that out of all of the symptoms of MS, kind of the most disabling really are the cognitive symptoms and fatigue, because, even if you're physically well, you need your brain to take care of yourself, to work, and to be productive. And, people with cognitive decline tend not to do all the other things, all the exercise, stimulating their body, interacting with people that are really going to cause them to thrive in the long run. If you don't have your brain, you don't have anything. That's kind of the most important thing.
Right. And then do you feel that once, when you're working with somebody and you're having that initial conversation with them, and they come in and you've made the diagnosis, but this is that first conversation after the diagnosis, and one of the things that they have said is that they are experiencing these problems thinking, and I don't think anybody initially comes in and says, well, I'm experiencing some cognitive decline, but they might say things like, my memory has gotten worse, or I was in the middle of a sentence and I just had to stop because I couldn't think of the word, or with me, my big one was forgetting my kids' names, right? And I know my kids' names, obviously, but I would just go, and then they would fill in the blank for me. And so when you're having that initial conversation to discuss that, do you find that there is more of an emotional response? Because it's almost like, I think I felt like I was losing my identity from the things that I couldn't remember, or not being able to talk the way that I'm used to, or saying something different. So where they used to call me a wordsmith and, say, you don't need a thesaurus if you've got Yvette. Now you need a thesaurus and a dictionary, right? So is that your experience with people newly diagnosed, that's the emotional thing for them, or is it more the other parts of it?
Well, I think that it's a very common symptom. We think that a lot of these subtle cognitive issues have to do with communication between different parts of the brain. Like, a lot of people with MS have a lot of damage to the corpus callosum,
Mm-hmm.
which, doesn't directly influence memory or executive thinking, but it's involved in communication between different areas of the brain. So people complain of difficulty with word finding, difficulty with, multitasking. And so I think a lot of people want an explanation for their symptoms. But I think people who are newly diagnosed, they tend to be under a lot of stress and notice everything. And I sort of assure a real symptom. You're not imagining it. It is related to MS, but it's not like you're going to become demented because of this. It's not a severe sign. It's something a lot of people deal with, and most people are able to kind of learn to compensate with it and improve over time. And through stress management, meditation, you training your brain, having a good diet, getting exercise. Most people don't have severe cognitive dysfunction and can live a good life.
That's amazing. So let's talk a little bit too about, I want to just go back to remyelination first. So when if we're trying to do something that is really targeted and, specific, I guess, I want to carve out a little piece that I know that this is what this is for. This is the activity. These are the things I'm going to eat. This is what I'm going to do specifically because that's the repair that I want to make. What is it that you recommend for doing that?
Well, I think that try to exercise regularly. The mechanism may not necessarily be remyelination. People have, the brain has neuroplasticity in many different forms. People have done studies on violinists, and if you look at the motor cortex that's dedicated towards the use of the dominant hand in violinists, they have a larger area of the brain dedicated to that function. So even though they're not necessarily changing their brain, they're just using more of certain parts of it to do certain things. People have looked at blind people who know Braille, and they have more sensory representation of the dominant hand they use to do Braille. And people have done other studies on divers and drivers who have to have very strong spatial skills and have changes in the perihippocampal gyres. So there are different things that you can do. There's also formation of new synapses and pruning of old synapses. So it's a little bit hard to say what this single intervention is going to do this. But I think exercise has proven benefits in terms of using more of your brain to do that tasks. It has an effect in terms of neurogenesis, forming new neurons, which may have more of a long-term effect in repair, and also combating other things like muscle atrophy and things like that. I think in terms of diet, overall, specifically in MS, there's some research on, there may be a link between saturated fat and MS. It's a little bit controversial. Some long-term studies show that people who eat more vegetable protein have a lower risk of MS. People who eat more fish have a lower risk of MS. And salt, sodium in processed food seems to be linked to MS. So avoiding processed food, eating primarily whole fruits and vegetables is probably the way to go. Trying to get adequate sleep. These are the most dramatic things that you can do right now in terms of lifestyle modifications.
And when we talked about sleep, you said that it's spending time in REM sleep or rapid eye movement sleep is when you seem to see the best response. Your body responds better to that kind of sleep. But I do know that, in the beginning of my journey, my big thing was I was super fatigued, but I also had insomnia. And so my sleep patterns were off all the time. Even I would go to bed early because I knew that I had to do something the next day and I wanted to try and let my body adjust and be prepared. And then I would sit there, yawning, these huge yawns, but not sleeping. Right? So if that's one of the things that's going to help me and that's going to improve my cognitive situation, which is what I'm always after, right? What do you tell your patients to help with that? Because part of the problem for me is that I can't turn my brain off. I'm always, all these scenarios are always running through my head, and that's a big part of it.
Yeah, to be honest, a doctor with 2 young kids, I probably shouldn't be talking to people about how to sleep because I certainly don't do it myself. But what you're describing is common. Sleep is like the Red Queen from Alice in Wonderland. The faster you chase it, the faster it runs away from you. But some of the things that help are trying to avoid caffeine. Caffeine has a really long half-life. It can be up to 5 hours. So even after 10 hours, you may still have a quarter of it within you. So even if you don't feel energetic from you, it may be keeping you up. So definitely avoid caffeine except in the morning, and try to drink reasonable amounts if you do drink it. And sometimes some things that help are behavioral sleep management. Like, you don't want to associate your bed with doing things other than sleeping. You don't want to watch TV in bed, or read in bed, or be on your cell phone in bed. That's probably the worst. You want to try and, later in the night, decrease your activity, turn the lights down a little bit. Don't eat or exercise right before bed. And then if you can't sleep after 20, 30 minutes, just get out of bed and read a little bit in dim light until you feel tired, and then try again. Some other things that help are doing regular meditation. I recommend this book called, 8 Weeks for Finding Peace in a Frantic World. I probably blew that title, but it's a great book you can get on Amazon, and you don't even have to read the book. You can just do the meditations. And I've had patients have great results with that. I'm not a big proponent of sleeping medications, generally speaking, but if you do have a certain symptom that's keeping you up, such as muscle stiffness and pain, it's reasonable to try and treat that symptom so that you'll be able to sleep, and or frequent urination, that kind of thing. And another thing that's sort of underrated is, just because you have MS doesn't necessarily mean that everything is related to MS. If people are complaining of daytime fatigue, I make sure that their B12 is okay, their thyroid is okay, they're not anemic, they're not deficient in carnitine. And if appropriate, I'll have people tested for sleep apnea, because you can have two different things and just assuming everything is due to MS.
I think that is that's really important to say, because comorbid situations often get blamed. Everything gets blamed on MS, and that's one of the things that I talk to people about. Is like, just because you see me a certain way, it doesn't mean that it's always MS related. I actually live a whole full life, and I'm a whole person, and I have all kinds of things that are going on. But when you're living it, when something new happens, you do want to ask the question. I had some changes, and I went to my neurologist, and I said, I'm experiencing this, and this. And he's like, oh, okay. And I'm like, no, did you hear me? I'm experiencing this, and this, right? Because I think that sometimes we just want somebody to tell us, no, this isn't MS, or yeah, that's related to your MS, but you're okay. So how often do you have to have that kind of conversation? Do you see that a lot, where patients blame like every little thing on MS?
I mean, I have that conversation every day, but can I tell you 100% whether every single thing that you feel is related to MS or not? No, but I do the best I can. I use my best judgment, and we rule out other things, and make sure we're doing what we can do to intervene.
That's awesome. Okay, well, we're getting a little bit low on time, and there were two questions that I wanted to ask before we run out. So when we talked about playing the brain games or doing the exercise, the nutrition part of it, that's you should always be eating healthier. But for doing these other activities that we hope to improve our cognition, how much time do you recommend we spend on these? So how much time should somebody be exercising? How much time should somebody be devoted to cerebral exercising? If it's learning a language, or if it's playing the games, or whatever.
Well, I think in terms of physical exercise, if you can try to do something most days of the week, like if 5 days a week you can do 30 minutes, that's a good start. And some people with MS may have to take rest breaks. They can't do it continuously, but that's okay. But I think if you can commit to doing something most of the days of the week, that's good. And same thing in terms of intellectual exercise. If you're doing something that challenges your brain for any amount of time, most days of the week, that's a pretty good start. And my personal opinion, it's pretty unlikely that you're going to be able to do one thing your whole life. You have to change. You do the brain games for 6 months, you get tired of it, you move on to something else. And that's okay. Constantly do new things and challenge yourself. Make it part of your lifestyle.
Okay. And then this one is more about sort of relationships with people, because MS is not understood well by people who don't have it. Do you find that this, when I don't know if you typically have, the partners come in together to have the discussions with you or not, but do you find that when you have the person without MS in the relationship who does not understand, do you feel like that slows down or or I don't want to say stops, but has a negative impact on improvements and the ability to move forward with things for the person who has MS?
Well, definitely most of the time I see patients, they're with their spouses if they have them, or girlfriends or boyfriends. And I think that, one thing that Dr. Aaron Boster, who also posts on Twitter at Ohio State MS, he said that, when one person has MS, the whole family kind of has MS. So it is important for everyone to understand. And, people need a little bit of support, and they need people to understand. Even if they can't help you, if someone just understands and acknowledges what you're going through, that makes a big difference. I mean, I had a patient and he told me, every time he complained about something, his wife would be like, "Are you going to use the MS excuse again?" And it was catastrophic to both him and their relationship. So that's definitely something to be avoided. But, I would say most of the time I see incredible support from family and from spouses. And, I see people go through amazing things and make amazing sacrifices to help their relatives. And, hopefully most people are in a position to experience that. I know not everyone has that, but it is incredibly valuable if you have that support.
That's amazing. So you have a free gift for our viewers. Tell us about that.
So I'm not selling anything, but I have an interest in nutrition and MS. And if you're interested, you could go to the website caloriedense.com and click MS, click the article on MS and take a look at it. It's sort of an evidence-based review of all the research that's been done about diet and MS, and I give some recommendations at the bottom.
Perfect. So guys, I'm going to have the link to that right below this interview, and make sure that you click on that and go take a look, because it's really great information. And anytime that we want to make improvements, we need to improve what's going on in our mind first and understand what's available to us and the direction that things are going in order to be able to get better. So thank you so much for joining us today and for giving us some really great information. This is probably one of my favorites, just because I know it's the symptom that I struggle with the most. I've been able to do things with my lifestyle to help with the fatigue, but the cognitive thing, and I know part of it is just because I like the thought of being smart, and anything that, pulls away from that kind of makes me go, ooh. But you gave us some really great information, and I'm looking forward to even more research on some of the things that we talked about today so that I can learn more. So thank you so much.
I think you're doing an incredible job. It's amazing the things you've done. I've seen some of your other videos. I think a lot of people are going to get a lot of benefit out of this.
Awesome. All right, guys, that's it for this episode. So go ahead and you can also follow him on Twitter. I have the link for his Twitter feed there. Make sure that you connect with him. You have to check out some of the stuff that he posts. It's really well researched and really good information. And you definitely want to be in the know as you live with this disease. So everyone can go out and no longer have to be just surviving. We're going to go beyond that to thriving. Have a great day, and we'll see you on the next episode.